You know, it's one thing to make a decision to have plastic surgery and talk to your partner, maybe some adult family members, maybe a trusted friend, but what do you tell your kids?
I've always instructed my patients to tell me more about their child's age, what kind of psychological position they're in their self-development. And if they're in a fragile state, you know, a young pre-adolescent girl, for instance, they don't want to see their mom change. So typically my patients will either do a surgery like a tummy tuck or a breast aug when their kids are at camp, or they'll come up with some kind of story, you know, like a hernia for a tummy tuck. For a breast procedure, they hurt themselves at the gym and they're having an orthopedic procedure on their shoulders. So it just depends. We talk through the age of the child and where they are developmentally.
Well, I think it's important, especially for young children, if the patient is having a mommy makeover, that their children realize that there's something that happened to their body to understand, as opposed to a purely cosmetic or aesthetic procedure.
Is there a danger there in terms of giving them the wrong message too early?
Of course. I think that's the key to understanding, you know, what level of development the child is. But I think it's critical that when talking about plastic surgery, especially mommy makeovers, that it's couched in the realm of restorative surgery. You know, mom's trying to restore something that she had. Not blaming the pregnancy process, but just restoration.
What happens if there is an obvious change, like a facelift?
So in a facelift scenario, I think it's important that during that early postoperative period where there's the most bruising and swelling, even the most well-adjusted child is going to feel badly.
They're going to be worried.
Right.
I mean, seeing their mom or their dad.
Right. Like Dr. Cassis mentioned, having when the children are away, or the patient can take the time to recover for at least the first several days. And at that point, again, I would talk about being restorative as opposed to changing who they are. They're still the same person.
Do you think it also can help, depending on the age of the child, having them be part of the post-op recovery, you know, helping out?
No, of course.
I definitely think it's important, as long as they're not too involved in the medical side of it in terms of incisions and things like that. But I think it's important to have the child be on board to help their parent to get through this time of convalescence as they're healing, especially in the first few weeks after surgery.
If you'd like more advice like this on any range of subjects, go to theplasticsurgerychannel.com.